Check. Yeah, good morning everybody. And today my presentation is on different types of corneal foreign bodies post-injury and its correlation with specific occupation. As you all know, corneal foreign bodies are the most common ophthalmological emergency cases. This type of injury often occurs at work, domestic, leisure activity like home, gardening, playing, sports, or on a windy day. Ocular trauma is the leading cause of unilateral loss of vision and visual impairment. Corneal foreign bodies are small particles that impinge upon the cornea, causing ocular symptoms including red eye, foreign body sensation, irritation, tearing, pain, blurred vision. Removal of this corneal foreign body is necessary, and they may cause corneal opacities, rustring, and secondary infection like bacterial keratitis and ophthalmitis. Corneal foreign body are the common occupational hazard and cause ocular morbidity and loss of time of work despite the use of safety precautions. Our aim of the study, what are the different types of corneal foreign bodies post-injury and its correlation with specific occupation. As you know, it is a hospital-based prospective observational study which was conducted in ophthalmological department at tertiary care center. The study duration was from January 2022 to December 2022. 90 patients was the sample size, and the subject selection method was who fulfilled the inclusion and exclusion criteria. Inclusion criteria included participated voluntarily in the study, age between 10 to 60 years, diagnosed or had suspected diagnosis of corneal foreign body, were able to complete the anterior segment examination with clear anterior segment color photography, had lesion with depth that did not exceed 2/3 of the corneal thickness. Exclusion criteria included age less than 10 years or more than 60 years, full thickness penetrating corneal injury with corneal foreign bodies, injury with signs of corneal infection. After tentative declaration Helsinki and approved by the Institutional Review Board and Ethics Committee, a verbal consent was obtained from the patient before completing the questionnaire. We asked about the demographic information, name, age, gender, education, occupation, activity at the time of injury at work, during leisure, domestic activities, the APOS was done or medication were used after the injury, time between the injury and the patient visit to the ophthalmology department, any previous similar eye injuries, availability of the protective eyewear at work, whether eyewear were used during the injury. We did the slit lamp biomicroscopy examination by putting topical anesthesia. Anterior segment photography was taken focusing mostly on the cornea and the depth of corneal foreign body. Corneal foreign body was marked as central, paracentral, peripheral, taking into account 3 mm radius from the center, 3 to 6 cm radius from the paracentral, and beyond that was peripheral as noted in figure 1. You can see there A, B, and C. Fluorescein stain was used if required to delineate foreign body and residual abrasion. Corneal foreign body was removed with 26 gauge needle or tubercular syringe and topical anesthesia. Topical antibiotic along with tear substitute were prescribed for the treatment. We did the statistical analysis. SSP version 24 was used. And from the result, we could find that the mean age was 36.7 years. It was more male preponderance, and the majority of the patients were between 31 to 40 years. Like 42.2% patients were between 31 to 40 years. Right side of the eye was more affected than the left eye. And when we check the various types of corneal foreign body found in the eye, we found that metallic foreign body was highest, around 53.33%, followed by dust and wood thorn. These are some different types of corneal foreign bodies: metallic foreign bodies, dust particle, wood thorn, corneal foreign bodies, glass foreign bodies, insect exoskeleton you can make out, plastic foreign body, gunpowder and glue Fevikwik injury. When we compare the various types of corneal foreign body found in the eye, metallic followed by dust, metallic was the highest. Distribution of corneal foreign body as per the occupation, we found that industrial and construction worker had highest, like industrial had the highest, around 54.4% patient had the highest as per the occupation, followed by construction and agriculture work. And the mean time of presentation, we can make out that the mean time was 2.15 days, but the industrial and construction worker came in less than 1.5 days. As you can see, 1.38 to 1.35 days. And domestic worker came after 3 days. The majority of the location of the corneal foreign body was in the paracentral area, followed by central and peripheral. And on the question when we found that the preventable use of protective eyewear could prevent around 65.5% patients if they have used it. So as discussion, corneal foreign bodies are the commonly seen ocular injury in day-to-day life. The industrial worker get injured by metallic foreign body due to the use of high-speed grinding drilling machine at workplace. Many construction workers are exposed to sand, metal, dust, cement, paint particles as their working place. At their working place, farmers are exposed to various foreign bodies like dust or vegetative matter. Most of their injuries are superficial, usually without visual disability, so they don't affect the patient's quality of life. It was observed that most of these corneal foreign body injuries could have been prevented if proper precaution and preventive eyewears were used. To conclude, the most common type of corneal foreign body found in the study was metallic foreign bodies. Most of these corneal foreign bodies were found in the paracentral area of the cornea. Industrial construction and agricultural work are the occupations where workers are more prone to corneal foreign body injuries. Take home message, corneal foreign body injuries can be prevented with proper precaution and preventive eyewears. Workers should be educated about such eye injuries, and steps should be taken to initiate public awareness program on large scale. This will help in improving healthcare and reducing workers' economic burden. Thank you.
Nice presentation.
Thank you.
Doctor. Actually, it's very common to general